Hawaii is nearly 2 years into the COVID-19 pandemic, but is this latest surge of infections coming to an end?
Many health officials report it's still too soon to tell. Case counts remain in the thousands. That's the highest they've ever been. The positivity rate now just under 20%. That means nearly 20 out of every 100 people who test for COVID have been infected. The Department of Health today also reporting nearly 4,000 new cases. Here's a look at the breakdown up on your screen. More than 2,500 reported on Oahu, more than 300 on Maui, the Big Island, Kauai, and Molokai back in the double digits again, and Lanai seeing no new infections.
Today's cases raise the total number of infections reported in Hawaii to more than 160,000. DOH also reports 3 more people have died after contracting the virus. That raises the state's death toll to 1,117. Now take a look at this epidemic curve. These are all the cases reported since March of 2020. You can see the curve pretty much flat until last August and September. That was a rise during the deadly Delta variant surge. State data show there was a 7-day average of nearly 900 cases at that time. Now we're seeing that average reach into the 3,000s. So when will infection rates start to come down finally? KITV4's Nicole Tam has been looking for that answer. She now joins us live tonight. Nicole.
Well, Rick, depends on who you ask. Lieutenant Governor Josh Green believes case count should start to drop before the end of the month, while researchers that model pandemic statistics say it's still too early to tell. Omicron cases in Africa have started to drop. Dr. Anthony Fauci, the nation's top infectious disease expert, predicts the Omicron wave in the U.S. could fade by the end of the month. The Hawaii Pandemic Applied Modeling Work Group, or HIPAM, a group of scientists that develop COVID-19 forecast models, believes it's hard to pinpoint a timeline because Hawaii's population is unique.
South Africa is on average much younger, and which means they're typically healthier, even though they're less vaccinated. And we also have a larger proportion of those who are at greater risk due to comorbidities.
In its next weekly report, HIPAM will look at the impact of Omicron on employment.
While Omicron is on average less severe than Delta, it's still severe enough where it's taking out hundreds and hundreds of our essential workers, which has rippling effects.
Lieutenant Governor Green has been watching COVID-19 infection rates. He says the Omicron surge of cases started in Hawaii around December 10th. He says hospitalization rates will start to drop 8 days after infection numbers start to fall.
There's no guarantees that those numbers will play out that way, but that's what it looks like because most of the people that had no vaccination whatsoever and no natural immunity, they caught Omicron.
The Department of Health reports the fluctuation of testing and lab reporting could contribute to numbers changing on a daily basis. A spokesperson says it would be a mistake to think the current surge is over. Reporting live, Nicole Tam, KITV4 Island News.